Hello there, I'm Miranda Gretton, and this is Take a Moment with NCHC, the show where we talk to you and your colleagues about experiences that affect you. Listen on your drive between patients or in your downtime, whenever you get the chance to take a moment.
I'm Donna Hudson. I'm the IPAC Team Operations Manager.
So, Donna, tell me your story.
Okay, so I have something called Brittle Bone Disease, osteogenesis imperfecta. It is a hereditary condition, but I was the first in my family to actually be found to have it. Now, it's not that other people before me didn't have it, it just wasn't that they were diagnosed with it. So it could be that I was they call it the mutation when it's kind of just arrives. It could have been that is what happened with me, or it could have been that people in my family before me, before, obviously the wonders of modern technology, they just weren't diagnosed with it. So what that's meant for me is I was born into a forces family. I was born on an RAF base in Cyprus and had a couple of breaks when I was really quite small. And what that meant as a child of the 70s is that my parents came under scrutiny from neighbours, thinking that they must have been abusing me because I broke a leg when I was only about a year old, and then I broke an arm as well. And they had assumed that was because people weren't looking after me. And it wasn't until we came back to the UK when I was almost 3 that somebody at a Royal Air Force hospital in Wiltshire, I believe it was, they diagnosed me with the condition.
How does the condition manifest for you then?
The thing that I have on a daily basis pretty much is pain. So the condition is, although it's to do with bones, it's not to do with calcium, it's to do with collagen. So it means that I either haven't got enough of it, or perhaps, hardly any, or the stuff that I have isn't doing the job as well as people who don't have the condition. So that means that it can affect my teeth, obviously my bones. It can affect ligaments and muscles and things like that. So when I say I have pain on a daily basis, it's usually because we tend to have hypermobility as well. So our joints can, and our limbs can move more freely than others. And because the muscles are not as strong, that means that, you can get sort of muscle ache. So you tend to have aches quite a lot of the time. So what you would assume is with brittle bones is that the bones break easily, and they do, but that's not all of it. There's more to it than that.
So, as a child, then that must have been particularly difficult because as an adult, knowing the condition, you can kind of manage it and not put yourself in particular situations. But as a child, not knowing what it was, or even knowing what it was, and you want to throw yourself about and play and go up the climbing frame.
Yeah.
So, how did you manage that when you were younger?
Well, I didn't. So my parents actually divorced when I was 5. And I do have siblings, but they're all a lot older than me. So they were adults by the time our parents had divorced. So it was just me and my mum at home. And because she was a single parent, then it was assumed that she couldn't look after me with this condition. So at the age of 6, I was actually taken away from her and put into a boarding school for 3 years. Now, the boarding school had 55 to about 60 children in there from ages 5 to 18. And everybody else in that school, apart from me, had asthma. Now, the thought of obviously children with asthma being taken into care now, that just wouldn't happen, but they didn't know what to do, and they just assumed that mum couldn't look after me. So they put me into this school on the Norfolk coast. If I was lucky, I was able to come home at weekends, but mum didn't drive. So it was pretty much that I was there for long periods of time. She absolutely did the best that she could, and I can't fault the upbringing that I had. But her idea of looking after me is that I wasn't allowed to do anything. So I had a childhood where I was watching other children live their childhood, if that makes sense. So I have 2 sons, and my oldest son is fit and healthy, but my youngest one did inherit it. So I very much want to wrap him up and stop him doing things, because obviously the pain when he is in pain is incredible. But my husband is very, very much of the vein, he needs to live his life, he needs to have a childhood. So it's just finding that, that balance between the two, because I don't want him to have the childhood that I had where he's watching everybody else have fun, but I don't want him to be in pain either. So but we I was born very early in the 70s, and you were just diagnosed with something, and that was kind of it. Whereas nowadays you have the internet. So as soon as my son was diagnosed, I found out so much more information about the condition than I ever knew before. So that's been quite interesting, and it's really helped me manage the condition with him. He does have a lot of anger, for want of a better word, because he really does want to be able to play football and things with his friends, and he's not able to do all of the things he wants to do. But this condition, we have the mildest form. And when my son was diagnosed, I was told that it normally, as it travels down through the generations, it will get milder, but unfortunately it's not been the case with him. So we have the mildest form, but he has it a little more severely than I do. But there are children who have different variations of this condition who, they break bones in utero and they die early. So you do have to be thankful, for having only what we have to deal with, because it could be so much worse.
I can completely see how your son would be angry because as a kid you can't regulate that emotion of jealousy and envy, can you? You're just desperate to get
No.
on and do what you want to do. But I suppose the difference between now and when you were growing up is that there must be support networks, there must be groups that he can go to, and people he can talk to on the internet, even, support groups where he can share his frustrations and really talk about the condition. Did you have anything like that growing up? Did you have anyone who you could talk to about it?
No, no one, because I didn't, throughout my childhood, I can't even remember, the first time that I came across somebody who had the same condition as me, but I had nobody growing up, nobody who understood. And although they say that in the UK, they think there's about 1 in 15,000 people who suffer with this, they don't know for definite because it's still not always spotted. Some people, they just put it down to being clumsy, but we are incredibly clumsy, and those two things don't really go together. But that is what it is. But no, there wasn't. You didn't have the forums on the internet and things that you could just tap into. So he's not appreciative of that yet, but hopefully he will be. I mean, he is the bravest little boy that I've ever come across. I mean, some of the injuries that he's had, he's dealt with them so well. But it's been tricky, but there's definitely more support, that the multidisciplinary teams that they have in the hospitals for us. So when he has his appointments, I really was very rarely seen when I was a child, unless I'd broken something. But he is seen regularly, and there's medication that they put him on which won't cure the condition, but he has broken vertebra in his back. So they put them on this medication that he has by infusion, in the hope that they could just puff the vertebra out a little bit and strengthen his back. But he hasn't had an injury to compress the vertebra. This is just from him walking about, living day-to-day life. So he is seen on a regular basis, which is excellent, and he's seen by his consultant, an OT, a physio. So the support at the hospital on all different levels is definitely there now.
And does that then, as a knock on effect, mean that you get that support as well?
No, not so much. I mean, I definitely spend a lot of time looking on the internet for information now, but I have now got a consultant as well, which is a fairly new thing that's only been like 5 or 6 years. So that's good. They see me on a fairly regular basis, and then I can have some tests and things. And unfortunately, because I'm female, once I hit the menopause, then I will have osteoporosis as well. So, which is a completely different bone condition. So that's why they're seeing me on a more regular basis now.
I'm interested to know what happens with this. So, is it a case of you go for a walk and if you were to trip over something, you would break a bone? Like what actually happens in that respect?
Yes. I mean, for example, I have probably in about the last 10 months suffered a cracked rib from turning over in bed. So that is just from whatever position I've been sleeping in. I've obviously caught it and cracked something. So it can be as simple as that. We stub our toes. I mean, I said we were clumsy. We stub our toes quite often, but I would say that we have broken toes probably once every couple of months, both of us. I even had an occasion where I stubbed the same toe twice 2 days running and managed to dislocate it as well. So yeah, that was not fun. But I think, and if my colleagues are listening, I apologise because they've heard me say this before, but one of the things that they say with people with brittle bones is that because we spend so much of our lives in pain, we have a really high pain threshold. So For example, Ethan had physio exercises that he needed to do that involved going up and down one of our steps at the bottom of the stairs, and he managed to break one of his feet by doing the exercises. But he suffers a little bit of pain, and then very quickly he just kind of gets on with things. So yeah, it's a strange thing to live with, but you just do kind of get on with it.
I suppose you have to, because it's all you know, isn't it? You can't measure your pain threshold against someone else's because you don't know.
No.
But so what happens if you break something but you feel like you can get up and get on? Do you have situations where you've left something and it's sort of healed over? And do you have any situations like that where you need to go back and have something corrected?
Yes, I've broken the same elbow twice and it didn't heal properly the first time. It wasn't set properly. So when it healed, it was fixed together with fibrous tissue rather than bone. So when I broke it the second time, it took quite extensive metal work to actually put that back in place. I would say the majority of our toe breaks, we don't even seek medical advice anymore, whether that's the right thing to do or not, because there's not really a lot that they can do for toes. Even with fingers now, we've taken to treating ourselves. So I have a stock of, they call them Bristol bandages, and they're like two bandages that are stuck together so you can immobilize the good finger with the bad finger. So we kind of just put one of those on now. So we don't seek advice for all of them, and as I said, that's maybe not necessarily the right thing to do, but when you know that there's not a lot that the hospital can do either, it's kind of just getting on with things, I guess.
Well, and I suppose knowing what we know about the services at the moment, we've got high waits at the hospital. I guess you don't want to put yourself in that environment, really. Working for the trust, this pressure that everybody is under. But having said that, it's still you and your son, it's your lives, it's your health. Do you feel a bit conflicted in that way that you almost, do you think you're treating yourselves because of what almost like an insider's perspective?
Yes and no. I mean, I don't have any concerns about doing it for me, but I do sometimes wonder if I should take him, up to the ED a bit more than I do. But then it's when you are in those situations and you've waited there for hours and you know that they're under pressure, and you think if they were able to put a cast on, if you've broken a couple of fingers and they were able to put a cast on, then they're just not. So it is, yeah, it is a bit conflicting, but it probably doesn't help that I do know waiting times and the lists and everything are as bad as they are. I have a really good support network for him, because he has a specialist orthopedic nurse that I can call, and I would say it's a 50-50 conversation normally, where half of the time they're like, yes, you've done exactly the right thing. And then sometimes they'll say, you know what, I think you should come up and have an x-ray. But of course, you have to balance that as well, because he's 12 and he's had so many x-rays. So it's like whether you put him through that as well.
If you know that this is going to happen all the time, you know what is waiting for you up at that hospital. You know it's a long wait and you know what the outcome's going to be. So it must be quite tempting, I suppose, to just try and treat it at home.
Yeah, absolutely. I mean, I have got an example of when I did have to keep going back to the hospital. And at the end, I did wonder why I kept putting myself through that, because I damaged the ligaments in one of my ankles. And because I'd been walking, obviously, to try and take the pain away and take the pressure off, I managed to give myself a stress fracture in the ankle. Now, I knew that I'd done it because not only did I feel it, but I heard it as well. So I went off to the GP and I said, I know exactly what I've done. It's a stress fracture. But of course, you then get referred and you go for an x-ray, and they couldn't see anything because it was that thin that, a stress fracture is obviously tiny. So they couldn't see anything on an x-ray. I waited a few weeks for a CT scan. They couldn't see anything on that. I then waited a few weeks for an MRI scan. They couldn't see anything on that. All this time I'm walking around with it with no treatment because they couldn't see anything. And it was only about 6 months later, when the bone had started to heal and they could see on the x-ray where the crack was, healing over, that they said, oh yes, you did have a stress fracture. So, that's a perfect example of me kind of putting myself in a waiting list, and actually I didn't receive any treatment at all. I treated myself with that, with a pair of boots that covered my ankle, so I had a bit of support. So yeah, it is really tricky though.
I mean, there's something there, isn't there, in terms of when we have a hidden disability or a long term health condition that we know and we manage ourselves. are we listened to enough as patients? I know what this is. It's XYZ. And then you're being referred to all these sort of expensive, long waiting services when you sort of saying, oh, it's so frustrating. I could tell you exactly what it is.
Yeah,
Do you
and
feel
really,
that for you and your son particularly, that you're not being listened to?
yes, definitely. You know how sometimes you get a feeling as a mum and you just can't put your finger on why, but you just have this gut instinct. Well, sometimes, yes, I do have that, definitely with myself and with Ethan. But Ethan is now starting to have that for himself as well, because we know our bodies, and we know our bones. So I said to you at the beginning, I've managed to injure myself again. And I went to the GP and he said, oh, this could be a stress fracture. But I know it's not a stress fracture because I know how I feel. And I know that everybody can't be an expert in everything, and that's not what I'm asking. But there's not that level of understanding of the condition, unfortunately. That example of my stress fracture, all I really needed was a boot, one of those little boots with a rocker, and I could have got around quite safely. So all what I did in the end was, as I said, I got one of my boots, and just started walking around with that on all of the time, so that I had some support. There is an element of you can't possibly know because you haven't had the training or whatever, and I don't think enough heed is put on the fact that actually people do know their own bodies.
Well, that's it. How could you possibly know, because it's inside and you can't see it? But that's
Mm,
exactly the point of a hidden disability, isn't it? That actually no one can see. You wouldn't know to look at you that if you fall over,
no.
you're going to break a bone. You wouldn't know.
No, exactly. Another thing that people think that I'm very strange about is that I wear sunglasses quite a lot of the time when it's not sunny, because we have one less layer on our eyeball. So our sclera is one less layer than person without the disability. So like a bright but cloudy day to me really hurts my eyes, so I'll be around with sunglasses. And the amount of comments I've had about that, people think I'm very strange indeed, but of course you wouldn't know unless you had it yourself.
I've heard people before talk to people who wear sunglasses inside as well, saying, oh, not sunny in here. Like all the little digs, the little comments that people think are funny, but actually can be quite
Hmm.
hurtful. As an
Yeah,
adult, you're probably able to manage those and tell people about your condition, aren't you? But,
yeah.
is it still hurtful when you hear people comment like that?
I'm going to sound awful here, but it's not necessarily hurtful now. I do find it irritating because I don't think people necessarily, if you wouldn't wear sunglasses indoors if you didn't need to. So it's a little bit upsetting. I mean, I've had managers who have implied that I shouldn't go on holidays because sometimes obviously I've managed to pick up an injury when I've been away. So I don't know whether it's people with disabilities are expected to just kind of sit at home and wait for the morning to arrive so they can go back to work. But people need to have some quality of life, as otherwise why are we here? And it's just the lack of understanding sometimes, I think. And that is because people can't see what's going on. So those people who are unfortunate enough to have cancer and have lost their hair, if they're wearing a wig or a turban, you can see that, but people with anxiety or stress or depression or brittle bones, something like that, you can't see it unless, like at the moment, I'm walking around on crutches, so you can see there's something wrong with me. But the majority of time, you wouldn't be able to see there was anything wrong.
That quality of life, do you find that sometimes quite difficult in terms of, if you know a situation might put you in danger of breaking a bone, do you avoid it, or do you think, no, I'm going to do it because it'll be fun, or I'm doing it for the kids, or I'm doing it for my family, and or I just want to do it? But is there something in the back of your mind that thinks, oh, should you be doing that, Donna?
I don't ever do anything now that I know could cause injury to me. And I don't like Ethan do anything that I know would cause injury to him. But just simple things like walking for too long, that can cause ligament damage in my feet sometimes. But of course, you don't necessarily know about this until you've walked for too long. So, I am old enough and sensible enough that I can risk assess what I'm doing, and I wouldn't knowingly put myself at risk of doing something. Ethan now, he's at high school, he's not allowed to play any contact sports. So the risk assessments for him at the moment are being done by his medical team and by myself and his dad. But there will come a time where he will know what he can and can't do. Obviously, once he turns 18, if he then decides that he thinks jumping out of an aeroplane, and going parachuting or something like that, it is what he wants to do, knowing what the risks are, that I can only guide him. I can't, decide for him once he turns into an adult. But that's not something I've ever done or would ever do.
No, me neither. Um, so, what's going to happen then as you get older? Will the condition get worse? What sort of things are you sort of looking towards now?
I think the osteoporosis may be the main problem for me, because obviously, when the bones are crumbling, that's a whole different ball game. So I guess going forwards, there's likely to be more of the breaks, like I was talking about, when I'm turning over and breaking a rib. But I don't know. I do know that I'm going to have to go on HRT to try and help somewhat. But yeah, I think it's just probably more of the same, and just more of the risk assessing what I do before I do it. But it's those things like going to bed and going to sleep. You assume you're going to be safe in your bed. It's those sort of things you just can't account for.
No, you can't risk assess sleep, can you? I
Not
mean,
really. You'd think that sleeping in your bed was the one place you were going to be safe. So
does that add a particular layer of anxiety then, knowing that really you're not safe anywhere? Or do you not try not to feel like that?
yeah, I try not to. I think the beauty of having, not that I would ever wish for any of my children to have had this, but the beauty of having Ethan is that I don't spend too much time thinking about myself. So it is all about, him and his experience, and trying to make it as different from mine. As I said, I can't fault my mum because she did what she thought was the best thing, but it is about him having the best childhood that he possibly can. I mean, he's had surgery for the first time this year. He literally tripped over something and went down on his elbow, and it just completely smashed to lots of pieces. So he's got metal work now. So it's trying to educate him, and guide him, rather than focusing on me, because I do feel as though I have dealt with so much that I can deal with most things, to be honest.
If someone's listening to this and they have the condition, or they know someone with the condition, or they're just interested, what's the kind of overriding takeaway from having brittle bone disease that you would like other people to know about? Whether it is, don't make comments about the sunglasses, or, what kind of things would you want people to be aware of so that they can educate themselves about this condition?
I think if you've had it, or somebody who has it, I would say don't let it define you or them. Realize that you're more than this condition. Don't sit and watch the world go by. Take part in as many things as you possibly can. And I think, as for the comments, I think it's a general thing, because having so many breaks and missing out on so many things, there is an element of depression with having brittle bones, as you would expect, because you do feel as though you're missing out. So it's just thinking before you do make those throwaway comments, just being kind, isn't it?
Thank you for listening to Take a Moment with NCHC. If you've enjoyed this podcast, please visit the podcast intranet page to leave a comment and for details of our other episodes. You can also follow NCHC on all social media channels.